2012 was really a monumental year for Hillcrest. It was the first full year that we had an expanded system. Part of getting that message out to our patients, the community, is that we're now a bigger system, and so part of what we did was to put together a new brand and common brand for all of the hospitals. We renamed several of the hospitals with the Hillcrest name, and the idea is that now people have more places where they can access our system, and they know exactly where those places are because of the marketing and branding.
We are Hillcrest.
We're going to be expanding in a number of areas, but a lot of those areas are specifically targeted at Hillcrest South. You know, that's where a lot of the growth in Tulsa has occurred and continues to occur. So it makes sense for us to add services out there. We're adding women's services. We've rebranded the women's unit as the Peggy V. Helmrich Women's Center, much like we have at Hillcrest Medical Center. But more than just the brand, we're going to be adding new services in terms of OB and gynecological services that aren't currently out there will be added in 2013. The other area that we're growing is with Oklahoma Heart. We're adding physicians, we're adding additional clinical capabilities, specifically at Hillcrest South. One of the things we celebrated this year was the 40th anniversary of Kaiser Rehab. Kaiser was the first inpatient rehabilitation program in the Tulsa area, really in northeastern Oklahoma. We're part of a larger corporate organization, and we have a thing called the Cup, the Arden Cup, that we give out to one hospital each year. And this year, Bailey Medical Center in Owasso won the Cup. It's been a good recognition for our folks in Owasso and at Bailey. We added a hybrid lab this year. And what that is, a hybrid lab is basically a cath lab inside an operating room. And that allows us to do more sophisticated, more high-risk types of procedures, because if you start out doing the procedure as though you were doing it in a cath lab, but if you had an issue and you had to get into surgery very quickly, you're already in a sterile environment, in a surgery suite. We were the first hospital in Tulsa to perform a new procedure called a TAVR procedure. And what this is it's a valve replacement, a heart valve replacement, where you go through a catheter rather than opening the chest and opening the heart and replacing the valve. You go through a catheter, place the valve inside the heart, and the patient ends up with a couple of stitches. Well, I think it's important to be a good corporate citizen, good community citizen. And the best way we can do that is to get our people involved. And so we're involved in a variety of different fundraising activities, United Way, Race for the Cure, the Heart Walk. Seems like we do a lot of walking and running, which is also good for a healthy organization and for our folks. But our people really enjoy getting involved in the community, and we give them the opportunity to do that by sponsoring some of these events that we're involved in. Mary Ann Nell is a very fascinating story. One of the things that we've done for a long time is participate in the Tulsa Run. And so Mary Ann this year trained an individual for his first time to run in the Tulsa Run, and he was blind. So she trained him, he completed the run, and they've still continued to run together and to train together and so forth. So a great example of how our people get connected with our staff, and employees get connected with patients and can do some things, not only taking care of the patient's needs, but do some things contributing in the community. And great story. We have a variety of individuals that have been here for a long time. And they've been part of the Hillcrest system. And they've seen some changes up and down and different types of things, particularly with the addition of new facilities and new doctors. But consistently through that, the people, the core of Hillcrest, is taking care of patients. And that's what I think we do best, and that's what our people do best. That's what it's all about.